Every year during open season, federal employees and retirees have the option to change their healthcare plan. But according to data from the Office of Personnel Management, usually less than 5% of FEHB participants change their healthcare plan during open season. However, if you're a federal retiree with Medicare Parts A and B, there may be some newer plan options that better fit your needs. Over the past few years, a growing number of FEHB carriers have introduced Medicare Advantage Plans as a healthcare option for federal retirees. In this video, we'll explain how these plans work and why they might be a good choice for you. But before we dive into the details, welcome to the Money Briefing. My name is Jarrell Harvey, and I'm with Fedway Financial. On this channel, we cover topics related to personal finance, federal benefits, and retirement planning. So if you find this video helpful, please consider sharing and subscribing. Since 2010, enrollment in Medicare Advantage plans have more than doubled. And as of 2023, more than half of all people who are eligible for Medicare are enrolled in a private Medicare Advantage plan. Despite this growing popularity, only a small fraction of federal retirees have signed up for Medicare Advantage plans. One of the main reasons is that traditionally, federal retirees had to either cancel or suspend their FEHB enrollment to join a Medicare Advantage plan. However, starting around 2021, the FEHB program began offering its own Medicare Advantage plans. Currently, there's about 8 to 10 carriers who offer national Medicare Advantage plans and another handful or so that offer plans only to the markets that they serve. Although these plans have existed in FEHB for a few years, they have remained under the radar because they don't receive nowhere near the advertising dollars as their private sector counterparts. While these plans may not get the same commercial airtime, most Medicare Advantage plans under FEHB offer better benefits and more savings than those offered to the general public. And they tend to have better benefits than mostly all traditional FEHB plans. So, to better understand how Medicare Advantage plans work, let's first review some of its basic features. Medicare Advantage plans are also known as Medicare Part C, or you may hear them referred to as MA plans. These plans provide an alternative way to access Part A and Part B benefits instead of using original Medicare. Most MA plans also include Part D for prescription drug coverage, and they often provide additional perks like vision, hearing, dental, and other wellness benefits that are not typically included in original Medicare. To join an MA plan, you must first be enrolled in Medicare Parts A and B. With Medicare Advantage plans under FEHB, you're able to retain your active status in FEHB while receiving an enhanced level of benefits that are uniquely designed for federal retirees. When you enroll in a FEHB Medicare Advantage plan, you'll continue to pay your FEHB monthly premium as well as your Part B premium. However, most of the MA plans under FEHB offer an annual reduction to your Part B premium. This reduction varies by plan, but is usually between $75 and $150 per month for each eligible person. So a married couple who are both covered by Medicare could save anywhere between $1,800 and $3,600 every year in Medicare Part B premiums. Additionally, the premium reduction for many MA plans is directly applied to either your Social Security benefit or your pension check, or it could be credited to your quarterly bill depending on how you pay your Medicare Part B premium. This is different than the reimbursement programs offered by some of the traditional FEHB plans because the Medicare Advantage plans apply the subsidy automatically to your payment method rather than having you complete a form online or submit paperwork to get reimbursed. Another major benefit of Medicare Advantage plans is the low out-of-pocket costs. Generally, there are no copays and no costs for covered medical services, so you won't be charged for doctor visits, hospital stays, lab tests, or any other type of care that you receive. There are also no deductibles and no out-of-pocket maximums for many of the plans. A lot of the Medicare Advantage plans in FEHB are national plans, which basically means they have providers in all 50 US states and DC. Typically, you can also see both in-network and out-of-network providers as long as they accept both Medicare and your healthcare plan. Outside of monthly premiums, most federal retirees will only be required to pay for their prescriptions. However, the prescription drug programs that are associated with FEHB Medicare Advantage plans usually have an expanded formulary of covered prescriptions. They also have lower cost shares, and starting in 2025, there will be a $2,000 cap on the amount you pay out of pocket for prescription drugs each year. This can be a significant cost savings for individuals who are required to take expensive prescriptions. Even though there are many benefits of Medicare Advantage plans, they may not be the best fit for all federal retirees. And there are a couple of cautionary things that you should be aware of when considering these plans. Federal retirees with incomes that exceed the annual thresholds for IRMAA payments may not get as much cost savings by enrolling in Medicare Part B. Also, the prescription drug program offered through FEHB Medicare Advantage plans are considered Part D plans. So again, depending on your income level, you may have to pay an IRMAA for this Part D coverage. Additionally, if you live abroad or frequently travel internationally, MA plans might not be the right choice for you. MA plans only cover emergency care overseas, so you wouldn't be able to get any routine care. There's also a special Medicare rule that causes Part D not to reimburse or cover international prescriptions. If you're not impacted by IRMAA charges, or if you do not do a lot of international travel, then it may be worthwhile to do some comparison shopping of your current FEHB plan versus some of the available MA plans in your area. If you're thinking about enrolling in one of the MA plans, you can do so in a few steps. As I mentioned earlier, you must already be enrolled in Medicare Parts A and B before you start the process. If you're not, you can enroll in those parts by going to the Medicare.gov website or by visiting a local Social Security office. If you've already got that box checked, your first step is to enroll with OPM in the FEHB plan that corresponds to the Medicare Advantage plan that you want to join. For example, if you want to enroll in the GEHA Standard Medicare Advantage plan, you'll need to first enroll in the GEHA Standard FEHB plan by either calling OPM's Information Retirement Center or by logging into the Open Season Express website. If you're already an active member of the traditional FEHB plan that you want to join, you'll want to bypass this step. Once enrollment in the FEHB plan is processed and confirmed by OPM, you'll need to call the Medicare Advantage carrier to enroll in the MA plan. The phone number that you would need to call will usually be on the carrier's website, or you can get that number from OPM. Also, if you have a spouse that is younger than age 65, or if you have dependents that are not covered by Medicare Parts A and B, they will receive the traditional FEHB plan benefits of your standard plan, while you'll receive the enhanced Medicare Advantage benefits. Overall, due to the generous premium reduction, the zero cost for most medical expenses, the cost savings on prescription drugs, and the expanded coverage for services such as vision and dental care, many federal retirees can get tremendous savings and better benefits by switching from popular FEHB plans to one of the Medicare Advantage plans. If you received any value from this video, please click the like button. You can also subscribe to our channel to get more content like this. If you're interested in seeing how we help our clients at Fedway Financial get the most out of their money and federal benefits, please visit our website at www.fedwayfinancial.com or click on the meetup link in the video description. Thank you for watching. We see you on the next Money Briefing.